The confirmed number of new coronavirus cases reported in Los Angeles County over the last 24 hours is 18,822, with 36 additional deaths. Here in Torrance, 156 additional cases were reported with no new deaths. Welcome to COVID-19 Today. I'm Rhiannon Trutanich. It's Tuesday, January 25th. COVID-19 deaths have been soaring in LA County over the past week, and officials say many of them appear to be from the Omicron variant. Of the 102 deaths reported last Thursday, 90% involved people who fell ill with the coronavirus after Christmas, and 80% were among those who got sick after New Year's Day. LA County Public Health Director Dr. Barbara Ferrer says these individuals are very likely to have gotten the Omicron variant. Health officials say it appears that people who are dying from the Omicron variant are deteriorating much quicker than those infected with earlier variants. During the summer Delta wave, COVID-19 patients were diagnosed with an infection or started having symptoms 4 to 5 weeks before their deaths. But among the more recent fatalities, many had an initial onset of symptoms or first diagnosis 3 weeks or earlier before their deaths. LA County averaged 57 COVID-19 deaths over the 7-day period that ended last Thursday, surpassing the spring 2020 surge at the start of the pandemic. Though there are signs that Omicron has peaked in California, officials expect hospitals to continue facing challenges in the days and weeks to come, noting certain sectors of the state are still reporting very high numbers of the virus. On a brighter note, more healthcare workers in LA County are getting their booster shots ahead of the February 1st deadline, and we're seeing some positive consequences as a result. Public health data shows that COVID-19 cases among skilled nursing facility residents and staff members are dropping in part due to the high numbers of those who chose to get vaccinated and boosted. Vaccination rates among those eligible are 91% for residents and 97% for staff. As for booster rates, residents were at about 82% as of January 9th, and staff members were a bit lower at 65%. With more residents and staff fully vaccinated and boosted, new cases have gone down by 14% among residents and 30% among workers for the week ending on January 23rd, when comparing it to the previous 7 days. CDC studies show unvaccinated adults are 5 times more likely to get infected with the coronavirus than those who are vaccinated, and a booster dose is 90% effective at preventing hospitalization. All booster-eligible healthcare personnel in LA County are required under the revised health officer order issued on December 23rd to get their booster dose by next Tuesday. Pfizer and BioNTech began a clinical trial for their Omicron-specific COVID-19 vaccine candidate. The study will evaluate the vaccine for safety, tolerability, and the level of immune response as both a primary series and a booster dose in 1,420 healthy adults ages 18 to 55. The study is broken up into 3 groups. The first group received 2 doses of the current Pfizer vaccine at least 90 to 180 days before the study, and will get 1 or 2 doses of the Omicron-specific vaccine. The second group got 3 doses of the current Pfizer vaccine at least 90 to 180 days before the study, and will get 1 dose of the current vaccine or the Omicron-specific vaccine. And the third group did not receive any COVID-19 vaccine and will get 3 doses of the Omicron-specific vaccine. The Omicron-specific vaccine will be administered as a 30 microgram dose, the same as the current vaccine. Pfizer already began manufacturing the Omicron-specific vaccine, saying they are being proactive should it be needed, but will of course work on getting the results, having discussions with health authorities, and waiting for approvals before it gets deployed. Meanwhile, COVID-19 antibody drugs are being halted after health regulators say they don't work against the Omicron variant, which now makes up most of U.S. infections. The U.S. Food and Drug Administration is revoking emergency authorization for the drugs from Regeneron and Eli Lilly, which were purchased by the federal government and have been administered to millions of Americans with COVID-19. Doctors now have alternate therapies in place to respond to early COVID-19 cases, including 2 new antiviral pills from Pfizer and Merck, but both are in short supply. An antibody drug from GlaxoSmithKline is also shown to be effective, but in short supply as well. Both Regeneron and Eli Lilly previously announced they were developing new antibodies targeting the Omicron variant. The FDA's move comes days after remdesivir's use was brought in to treat more patients. Remdesivir is the first drug approved for COVID-19, and on Friday, the FDA expanded the antiviral drug's approval to include adults and children with early COVID-19 who face a high risk of ending up in the hospital. It was previously limited to only hospitalized patients. A new law kicked in earlier this month requiring private insurers to cover the cost of 8 at-home COVID-19 rapid tests each month, but it does not apply to seniors with Medicare. It turns out the laws governing traditional Medicare do not provide for self-administered diagnostic tests, which is exactly what the rapid antigen tests are. The Federal Centers for Medicare and Medicaid Services issued a statement saying, while at this time the original Medicare cannot pay for at-home tests, testing remains a critical tool to help mitigate the spread of COVID-19. Medicare patients seeking free at-home COVID tests can go to covidtest.gov or visit community centers. The U.S. Department of Health and Human Services say they're providing up to 50 million free at-home tests to community health centers and Medicare-certified health clinics for distribution at no cost to patients and community members. The department also established more than 10,000 free community-based pharmacy testing sites around the country. HHS officials say Medicare patients can also get other COVID-19 tests performed by a lab free of charge to them. A new study taking a closer look at the Pfizer-BioNTech booster shot says antibodies that neutralize the Omicron variant remain strong after 4 months. Researchers from the University of Texas Medical Branch teamed up with Pfizer and BioNTech to look at serum samples from vaccinated individuals and tested their neutralization of an older coronavirus strain and an engineered version of the Omicron variant. They noted that antibody levels went down somewhat over time, but held steady at 4 months. Previous studies found that 2 doses of the vaccine was, quote, not sufficient to elicit robust neutralization against Omicron, but 3 doses of the vaccine increased the magnitude and breadth of the neutralization against Omicron. The authors say more real-world effectiveness data and lab investigations will further reveal how long the protection lasts, if another dose is needed at a later time, and whether an Omicron-modified vaccine is required. The preprint study has not yet been peer-reviewed or published. Costa Rica and Peru are now among the riskiest places to visit during the pandemic. The U.S. Centers for Disease Control and Prevention added 15 more destinations to its highest risk category for travel. Also making the list this week is the United Arab Emirates. A country is labeled as level 4 COVID-19 very high when there are more than 500 cases per 100,000 residents in the past 28 days. Last week, the CDC added 22 destinations to that level. There are currently more than 100 countries listed, including Canada, France, and Germany. Billionaire investor Mark Cuban launched an online pharmacy offering generic drugs at low prices. The new business is called the Mark Cuban Cost Plus Drug Company, and it promises big discounts over traditional distributors. The pharmacy bypasses healthcare industry middlemen and help consumers avoid high drug prices by charging manufacturers' prices plus a flat 15% markup and pharmacist fee. The Dallas Mavericks owner tweeted the big news last week and asked his followers to sign up and share their thoughts. This comes at a time when 18 million Americans reported being unable to afford at least one doctor-prescribed medication in the past 3 months, according to a Gallup poll. Cuban's pharmacy negotiates drug prices directly with manufacturers to lower the costs for consumers. It does not accept health insurance, but the prices are well below what people would typically pay. The website currently offers 100 generic drugs to treat a variety of illnesses, including allergies, asthma, diabetes, and heart conditions. The SAT tests taken by prospective college students will become all digital and shorter. Starting in 2024, the College Board announced the 3-hour in-person exam will be shortened to 2 hours. And all test takers, while needing to be in a supervised setting, can take the tests in an easier format. Officials say they're not just putting the current SAT on a digital platform, but rather taking full advantage of what delivering an assessment digitally makes possible and adapting as they go. The transition comes months after the College Board pilot tested a digital SAT last November in the U.S. and internationally. 80% of students said they found it less stressful, and 100% of educators reported a positive experience. Some of the changes include no more sharpened number 2 pencils, shorter reading passages with 1 question each, and calculators allowed during the entire math section. Students will also get back their scores within days rather than weeks. The move to digital applies to all of the SAT suite. The PSATs and International SAT will go digital in 2023, followed by the U.S. SAT a year later. The College Board says these shorter all-digital tests will give more flexibility to states, districts, and schools in deciding where, when, and how to administer the test. Torrance City Council members head back inside the chambers tonight to conduct city business. Among the agenda items to be discussed include a recommendation of the city clerk for city council to adopt a resolution calling a general municipal election on Tuesday, June 7th for several purposes, including electing a mayor and council members for districts 1, 3, and 5. The city manager and finance director will also recommend city council to review resident polling results and take the next steps to place a local 3/4-cent sales tax ballot measure for the June 7th election. And the city manager will also recommend that council award a product services agreement in the amount of about $614,000 for the purchase and assembly of temporary housing units and accessory units at 3290 Civic Center Drive as a special opportunity purchase. These items and much more will be discussed tonight, and while the council chamber will be closed to the public in the interest of maintaining appropriate social distancing and helping to reduce the risk of spreading COVID-19, the public can participate before the meeting tonight by emailing council meeting public comment at torranceca.gov or by calling in during the meeting. You can watch the meeting live on our website, YouTube, Facebook, and of course right here on City Cable beginning at 6:30 p.m. Well, before we go, at the end of each program, we like to share feel-good stories from our community, pictures, images, and videos that remind us of how resilient our community is and how Torrance truly cares. Torrance residents can take part in the Live Large, Adopt a Big Dog campaign by bringing home a new pet. The department is teaming up with Best Friends Animal Society to increase adoptions of the larger breeds, as they make up a disproportionate amount of animals killed in California's animal shelters. Through January 31st, the fee to adopt a large dog from the county shelters is just $22 and includes microchipping, spaying or neutering, and vaccinations. A large dog weighs at least 35 pounds. Families interested in adopting will receive free food, supplies, and medical treatment as well. Organizers hope to get 500 or more large dogs into homes by the end of the month. For more information, go to animalcare.lacounty.gov. What a great way to show how Torrance truly cares. Now, if you have a great story, an upcoming event, a photo or video you'd like to share, email us at covid19today@torranceca.gov. We'd love to hear from you. Well, that's our update for COVID-19 today. We'll see you back here tomorrow as Christine Lee brings you the latest. Be safe, stay healthy, and thanks for tuning in. We'll see you next time.